Blessings, I'm Nurse Aleyah, registered nurse and mom of 5. Welcome to my channel where we discuss all things women's health, including pregnancy, birth, postpartum, and our little newborns. Today we'll be discussing a topic that affects so many expectant mothers, which is pregnancy nausea, also known as morning sickness. If you're pregnant or have been pregnant, chances are you're familiar with this. In this video, we're going to be diving into what may be causing it, and most importantly, how to prevent and manage the severity of nausea and vomiting during this special time. Now let's get straight to the facts. So it's estimated that 70 to 80% of women experience nausea during pregnancy. Now for the vast majority of women, they may have mild to moderate nausea with or without vomiting. And there is a very small portion, about 2% of women, that experience a more severe form of nausea and vomiting during pregnancy, and that's called Hyperemesis Gravidarum, and this is something we'll touch on a little later. Typically, pregnancy nausea appears around week 4 of pregnancy and tends to subside around the end of the first trimester, 12 to 16 weeks. It often peaks or is at its worst around 8 to 10 weeks. But every pregnancy is different, so this is just a normal timeline. So what actually is going on in our bodies to cause this? I wanted to dive a little deeper in research to truly understand the root causes of pregnancy nausea. And what I found is it's likely a combination of different factors. Once we become pregnant, so many changes happen at the same time, so it's hard to pinpoint exactly one single culprit. However, the biggest players are believed to be the hormones that are produced during pregnancy. For the longest time, the main hormone given credit for pregnancy nausea is HCG, or human chorionic gonadotropin hormone, or the pregnancy hormone. You will notice a strong correlation. So as this hormone rises, that's when pregnancy nausea normally appears, and when it's at its peak, that's when you'll find nausea at its worst. And then once this HCG hormone tends to decline, that's when you'll start getting that relief during pregnancy. But now there's a new hormone identified as a contributor, especially with more severe nausea. The hormone is called GDF15. Now this is relatively new research, and there is still a lot of understanding needed. But what's important to note is that both of these hormones, HCG and GDF15, are both hormones produced by the placenta. This leads to an interesting thought that perhaps the health and development of the placenta plays a crucial role. The placenta develops from a portion of cells from that fertilized egg. Personally, and there is research to support this, I believe the health of the father, the quality of sperm, the health of the mother, the quality of her eggs, plays a crucial role not only in the development of the baby, but the development of the placenta and the overall health of the pregnancy, including the intensity of the pregnancy symptoms. High levels of estrogen are also linked to more severe nausea. Our bodies are used to a certain level of hormones, but once we become pregnant, these hormones rise exponentially. So our bodies just need time to adjust to these levels. Beyond hormones, other factors can make pregnancy nausea more likely. So your personal history matters. If you have a history of migraines, motion sickness, are prone to sensitivity to smell, that can also be it. If you experience nausea with oral contraceptives or during your menstrual period, it can also run in your family. If your mother or sisters experience it, you're more likely to experience pregnancy nausea. So pregnancy specifics play a role. Are you carrying multiples? And it's often more common in your first pregnancy. So if you're pregnant for the first time, it's likely to occur. Lifestyle and health factors can contribute. High stress or fatigue, if you travel frequently, and even being overweight can increase the likelihood and the severity of pregnancy nausea. And finally, this is important, nutritional deficiency in key minerals and vitamins such as B6, B12, magnesium, zinc, and vitamin D have been linked to more intense pregnancy nausea. This highlights the importance of ensuring that we're getting adequate nutrition prior to becoming pregnant. So focus on eating nutrient-dense foods as well as taking a prenatal supplement to give that extra boost at least 3 months prior to becoming pregnant. Okay, now let's get to the part that you're probably most interested in, especially if you're experiencing pregnancy nausea. Lifestyle modifications and dietary adjustments is what's going to keep that nausea from getting out of hand. We often call pregnancy nausea morning sickness, even though we know it can happen any time of day. However, it is more prominent in the morning. This may be due to lower blood sugar or having an empty stomach. So what you can do about this is have a light snack beside your bed. It could be crackers, a healthy granola bar, and just eat a little bit before you get out of bed. Eating foods high in protein can also be beneficial. Opt for frequent small meals rather than large meals. This can prevent being too full or having an empty stomach. Both trigger nausea. It's important to identify your triggers. What smells, what foods, or certain situations trigger your nausea. Once you know your triggers, try your best to avoid it. So if a smell is your trigger, try not to be around that smell. Open up a window, let air circulate in the room. Stay upright after eating. Laying down immediately after eating can cause you to become nauseous. Rest and relaxation are important. Tiredness can definitely worsen nausea. So be sure to take naps and make sure you're getting adequate sleep. If you find that your prenatal vitamins triggers your nausea, try to take it with a small meal or even right before bed. Staying hydrated is also key. Some people find that drinking plain water triggers nausea. So experiment with other ways to stay hydrated. Personally, I'm not the best water drinker. I like to drink coconut water. Drinking smoothies daily, that keeps me hydrated. Watermelon juice, anything that's gonna help you stay hydrated but not get you nauseous. Also, try not to drink large amount of fluids with your meals. Try to drink at least 30 minutes before or after you eat. When it comes to natural remedies, many find relief with ginger and peppermint. Ginger in various forms such as teas, capsules, little candies have been known to have anti-nausea effects and have been used for centuries to help with a upset stomach. Peppermint, often used with teas or aromatherapy. You can have a diffuser with essential oil peppermint. This may be helpful. Now I want to talk about vitamin B6 supplementation. As mentioned before, low vitamin B6 levels are linked to nausea. If you find that the lifestyle modifications and the dietary adjustments are not being as helpful as you need it to be, physicians often prescribe or advise the use of vitamin B6 supplements, usually 10 to 25 milligrams 3 times a day, but it's important that you don't take more than advised. I do want to share something that may be helpful. It does contain some of the natural remedies and the supplements that I've discussed in this video. Okay, so this is from Bloom and Bliss. It's called Nausea Defense. So what it has is vitamin B6, 25 milligrams. It has vitamin B1, which can often be depleted if you have more severe nausea and vomiting. It has a blend of organic ginger, organic peppermint leaves, and organic curry leaves, which is also good for digestion and nausea. So I don't know if you can see that. No, probably not because the light is so bright. But I'm going to share the link in my description. Now remember that small percentage of women who experience severe nausea and vomiting during pregnancy called Hyperemesis Gravidarum. And with this condition, it often results in weight loss, dehydration, and electrolyte imbalance. So it's important to contact your healthcare provider if you're experiencing this, just so they can help you treat and manage these issues. So help you get rehydrated, get more electrolytes, try to give you things that may be more helpful with your severe nausea and vomiting. Now I want to share my experience with pregnancy nausea for all 5 of my pregnancies. And I've kind of used some of these remedies and I have found them helpful. So with my first pregnancy, I did have pregnancy nausea early in the pregnancy. This was my most intense nausea. Okay, I just have the core memory. This may be too much information. The core memory of waking up. If I did not immediately eat first thing in the morning, I would be vomiting. I would vomit so hard. I just have this memory of me throwing up and just the water splashing me in the face in the toilet. It was terrible, but that memory stuck with me. But that was the worst nausea I'd had to say for all my pregnancies, because I had more of the vomiting. So my second pregnancy wasn't as bad as the first. The nausea just kind of lingered. I don't really remember vomiting, but it just kind of lingered throughout my pregnancy. I would just have to eat frequently. I remember being in nursing school during this time, and I would just have a bunch of snacks, just eating throughout all the lectures, and they couldn't say anything because I was a pregnant lady. And then my third pregnancy, I remember it being linked to motion sickness. So I would drive into work, and by the time that I got to work, got to my locker, put my things away, I would have to vomit. And it's only when I drove to work that I experienced this. And then pregnancy number 4, I think it was just light nausea. I really don't remember nausea as much in my 4th pregnancy. And then my last pregnancy number 5, I had nausea. I might have vomited once or twice. And then near the end of my pregnancy, I had a lot of nausea, only when I would overeat. Okay, I told y'all to eat small, frequent meals. I would be like, I'm hungry, and just overfill myself. I would regret it. As you can see, even with the same person, pregnancy can bring different experiences of nausea. So it's really just figuring out what works for you through trial and error. Pregnancy nausea, while common, can be definitely challenging, but understanding the causes and implementing these lifestyle and dietary modifications can hopefully prevent and reduce the severity of nausea during pregnancy. Remember to listen to your body, identify the triggers, and don't hesitate to reach out to your healthcare provider if you have any concerns. Thank you so much for tuning in today. If you enjoyed this video, found it helpful, please give it a thumbs up and subscribe for more pregnancy-related content. So let me know in the comments below what helped you during your pregnancy nausea. Your tips may be helpful to other expectant mothers.